Ridley Jopling classification. So this Ridley Jopling classification is for nothing but the leprosy. So now we are going to see the some questions. So first question is, what is and what are the characteristics of the TT, that is nothing but the tuberculoid leprosy. Tuberculoid leprosy. The next question is, what are the characteristics of the borderline type of leprosy? The last question will be, what is the characteristics of the lepromatous leprosy? So we'll find out these answers in this video. So in case of, firstly, we are looking at the tuberculoid leprosy. Tuberculoid leprosy. So the tuberculoid leprosy, it is we were firstly looking at the number and the lesions. So it is about 1 to 3 and it is well defined. 1 to 3 and well defined. And they are nothing but well defined hypopigmented macule. They are hypopigmented macules or plaques. Macule or plaques, and they have a elevated sloping border. They have elevated sloping border. Elevated slope border. And this is nothing but, it is nothing but a saucer right side up. So it's nothing but a saucer right side up lesion. It is saucer right side up lesion, and it is nothing but it is asymmetric distribution. So what about the size? So the size is that it is variable. It is variable size, and but it is usually large. Next, what about the surface on the lesion? It is dry, it is scaly, as well as it is infiltrated. So in a case a patient he presents with the tuberculoid leprosy, what about the sensations? So talking about the sensation, it is absent. Then looking at the peripheral nerves, what about the peripheral nerves? Peripheral nerves, it is asymmetrical. It is asymmetric, and there is a single as well as single nerve enlargement. There is a single nerve enlargement. And next, there is a nerve to patch may be palpable. So a nerve to patch is may be palpable. What about the presence of hair? Presence of hair is that it is absent. And looking at the bacteriology on the split skin smear. So the split skin smear. So looking at the bacteriology, it is negative. It is negative. Then we look at the typical lepra reaction. So the typical lepra reaction. So under this, it is nothing but type 1. So it is type 1. Now we are looking at the lepromin reactivity. Lepromin reactivity. So this is nothing but it is strongly positive. So we saw everything, and now we are going to look at the histopathology. So under the histopath, we need to know that it is dermal tuberculoid granulomas, and it is arranged around the nerve. It is arranged around the nerve. Next, there is no bacilli seen. There is no bacilli which is seen. Next, we move on to the next type, that is nothing but the BT. BT stands for the borderline tuberculoid. So here it is nothing but, again, it is a hypopigmented macules. So it is again hypopigmented macules or plaques. It is macules or plaques, and it is variable. It is variable in number. And other thing is, it is up to 10. There is up to 10. And occasionally they show the finger-like extension. There is finger-like extensions, and they are nothing but, they are pseudopodia, or it is aka the satellite lesions. Then we move on to the size of lesions. So they are, it is again, it is a variable size, and some lesions are large and some lesions they are large. Next we look at the surface. It is dry, and it is also scaly and infiltrated. So it is very similar to that of the tuberculoid leprosy, but the thing is, it is less than the tuberculoid type. And then the sensations, if you see these sensations, so sensation here are, it is diminished. Next we look at the peripheral nerves. So peripheral nerves, they are asymmetric, and it is enlarged. Asymmetric and enlargement of few nerves. Asymmetric enlargement of the few nerves. So what about the hair? If you look at the hair, it is diminished. That is, it is very less. And looking at the bacteriology, so this is nothing but the bacteriology on the split skin smear. So bacteriology on the split skin smear is nothing but, it is negative, as well as there is scanty of the bacilli. Then we look at the lepra reaction. So in case of the lepra reaction, it is nothing but, it is type 1 of reaction which is seen. And what about the lepra reactivity? So now we look at the lepra typical, that is, we saw the lepra reaction is type 1. So lepromin reactivity. So lepromin reactivity is nothing but, it is weakly positive. So now looking at the histopath. So under the histopath, we need to know that there are fewer tuberculoid granulomas, and there is the Grenz clear zone. And this is present in the upper papillary dermis, and they start to form. So it is present in the upper papillary dermis. And next is, the nerves are replaced by the granulomas. They are replaced by the granulomas. And next, looking at the fragmented bacilli, then there is also the fragmented bacilli. So they are seen with the AFB stain. Now we move on to the borderline type. So borderline type, it has characteristics of both the tuberculoid as well as the leprosy. So here looking at the number of and the type of lesions. So it is nothing but, it is a hypopigmented macules, or there is a plaques with annular and they are famously known as the Swiss cheese appearance. Swiss, it is a Swiss cheese appearance. So they're most commonly called as the Swiss cheese appearance. And they are nothing but it is inverted. They are nothing but inverted saucer. They are inverted saucers along with a punched out lesion. They are punched out lesion. And what about the number? So the number is they are about 10 to 30 in number. Next we look at the site of the lesion. So site of the lesion, it is a variable. The site is variable. And looking at the surface. So the surface is that it is dry. It is dry and it is scaly as well. It is dry, scaly, as well as it shows some kind of amount of shine. Next, we look at the amount of sensation. So what about the sensation? So if you look at the sensation is nothing but it is moderately diminished. It is moderately diminished. After sensations, we move on to the view on the peripheral nerves. So looking at the peripheral nerves, it is there is asymmetric involvement of several nerves. So it is asymmetric involvement of several nerves. And after the peripheral nerves, we look at the hair. So looking at the hair, it is again it is diminished. Then we look at the bacteriology on the split skin smear. So looking at this, it is moderate number of AFB is present. So there's moderate number of AFB. Then we move on to the uh, typical lepra reaction. So the typical lepra reaction is it can be 1 as well as 2. As we discussed, it has both characteristics of the tuberculoid as well as the lepromatous leprosy. So there is type 1 as well as type 2. And next we are looking at the typical lepra reaction. So that is type 1 and type 2. Then looking at the lepramin activity. So the lepramin activity, it is nothing but it is negative. It is negative or it is weakly positive. It is weakly positive. Now we move on to the histopathology. So what is a histopathology? So looking at the histopathology, there is a tuberculoid. Here is tuberculoid granuloma. There is tuberculoid granulomas. So the tuberculoid granulomas are less prominent. The tuberculoid granulomas are less prominent, and then there is a presence of a zone. So this zone is known as the Gren zone. There is a Gren zone. So this Gren zone is more prominent. It is prominent. Next we need to know is that there is a transverse section. There is a transverse section. So this transverse section of the nerve. So this shows a cut onion appearance. Cut onion appearance. Then we finally move on to the borderline lepromatous type. So the borderline lepromatous type. So here we need to know about the number and type of lesions. It has numerous. So as we move on to the leprosy part, the number becomes more. So it is nothing but it is numerous and it is hypopigmented. It is nothing but hypopigmented. And what are they? It is nothing but the hypopigmented macules. Then comes the papules. Next comes the plaques. And then some nodules as well, some nodules. And the lesions, they have Swiss cheese, as we saw in the borderline. So there is also Swiss cheese here. So there's Swiss cheese appearance, and this is nothing but inverted saucer. There's inverted saucer as well as it is known as the punched out. It is punched out. The punched out appearance. So this is almost symmetrical. It is nothing but symmetrical. It's symmetrical in appearance. Next, we look at the site of the lesion. So what about the site of the lesion? So here, the site, it is variable, and it is usually a small, it involves small site. And looking at the surface is shiny. It is shiny. And other thing to note is that the sensations is slightly diminished. It is diminished slightly. It is reduced slightly. And looking at the peripheral nerves, involvement of peripheral nerves, the peripheral nerves involvement is that it increases asymmetric. So this increase asymmetric, and this increasingly symmetric enlargement of nerves. So there's increase in symmetric enlargement of the nerves. Then we look at the presence of hair. So in case of the hair, it is slightly diminished. Then looking at the bacteriology on the split skin smear. So the bacteriology on the SSS is that it is slightly diminished. That is, there is a large number of the AFB. So in bacterial split skin smear, there is large amount of the AFB. Then we look at the lepromin activity. We look at the lepromin reaction. So reaction, we need to know that it is two types, that is 1 and 2. Then the lepromin activity. So when we talk about the activity, it is negative. Next we move on to the histopath of the borderline lepromatous. So in the histopath, we need to know that there is a prominent presence of the foam cells. Next, there is also a prominent presence of the Gren zone. And after this, there is also nerves. There is presence of nerves. So these nerves, they show a concentric. There is a concentric perineural. There's concentric perineural cell infiltration, and there is more conspicuous cut onion appearance. This cut onion appearance. Then when we look at the AFB, it is nothing but it is plentiful. And it includes small globi as well. Next, we move on to the last, that is the lepromatous leprosy. So when we look at the lepromatous leprosy, what we need to know is that looking at the number of lesions, it is again the hypopigmented and macules, the plaques, as well as there's presence of the nodular lesions. And the lesions number are many, that is, it is innumerable. So innumerable lesions, and it shows perfect symmetry. There is perfect symmetry. Then we jump on to the site of lesion. So looking at the site of lesion, it is small. The size of lesion. And next, looking at the surface. So if you look at the surface, it is shiny. The surface is shiny. And it is very small and shiny. Next, when we look at the peripheral, the sensations. The sensation is that it is mostly normal, or it can be slightly diminished as well. The peripheral nerves, looking at the peripheral nerves, there is a symmetric involvement. There is a symmetric involvement, and this is of the nerve trunk, symmetric involvement of the nerve trunks, and this is the presence of the glove stocking. There's glove as well as the stocking anesthesia. So there is the nerves, it may feel normal. The nerves, if you see, they may feel normal on the palpation. They feel normal on the palpation, or they may be also thickened. Now looking at the hair is basically, it is normal. So in case of, when we jump to the lepromatous leprosy, the hair is almost normal, the sensation is almost normal. Then when we look at the bacteriology in the split skin smear, so the bacteriology is that there is plenty of AFP. There's plenty of AFP, and this includes the globi as well. So globi are seen. Then looking at the lepromin reaction, so the reaction is that there is type 2. Lepromatous leprosy is nothing but of type 2, and beyond this, when we look at the lepromin activity, so the activity is that it is negative. Next, we look at the histopath features. So in the histopath, what we need to know is that there is a prominent Gren zone, and there's an expensive as well as the loose granulomas. Next, there's plenty of macrophages. There's plenty of the macrophages. So the plenty of macrophages, they are loaded with the AFP. They are loaded with the AFB, that is they have the Virchow cells as well as the lepra cells. Next, there is the AFB. The AFB is seen in the endothelial cells. The endothelial cells, and as well as the Schwann cell as clumps. So this is nothing but the globi. So next, there is also the nerves. Talking about the nerves, there is a minimal activity. There's minimally involved. Now we will go back to answering our questions. So the first question we asked was what is the tuberculoid leprosy? So the tuberculoid leprosy, we need to know is that the number of lesions is around 1 to 3. It is well defined, hypopigmented macules, it is well defined, and it has presence of the saucer right side up. So it is a saucer right side up appearance. And looking at the size of lesions, it is large. Size of lesion is large, and it is dry, scaly, and inverted. The sensation, if you see, the sensation is it is totally absent. Then looking at the peripheral nerves, the peripheral nerves is it is asymmetric. There is asymmetric, and it is single nerve. It is single nerve. And looking at the nerve, it is nerve to patch. It may be palpable. Looking at the hair, it is absent. Then the bacteria on the split screen smear. So this is again, it is negative. Then looking at the lepra reaction is lepra type 1, and lepramin reactivity is that it is strongly positive. Now looking at the histopath. The histopath, what we saw is there is a dermal tuberculoid granulomas. Dermal tuberculoid granulomas, that it is arranged around nerve, around a nerve. So what about the bacilli? The bacilli is that there is no bacilli seen. So now we go on to the next question. So the next question we asked was, what is borderline leprosy? So what is borderline? So borderline is nothing but it is hypopigmented macules. It is hypopigmented. It is hypopigmented macules or the plaques with annular Swiss cheese. So the Swiss cheese appearance. So again here there is a Swiss cheese. Here there is Swiss cheese. This is important to know. There is Swiss cheese appearance and there's punched out appearance as well. And this is variable in number. The number lies between 10 to 30. Then looking at the site of lesion, that is size of lesion, it is variable. And it appears scale, it appears dry, it appears scaly. This is the surface and it is slightly shiny as well. The peripheral nerves. So the peripheral nerves here, they have asymmetric involvement of several nerves. There is asymmetric involvement and this is of the several nerves. And then we move on to the hair. So looking at the hair, it is diminished. And looking at the bacteriology on the split skin smear. So bacteriology on the split skin smear. This is, it is moderate number of AFB. So there is moderate number of AFB which is present. Then we look at the Leprum reaction. Okay, the Lepromin reaction. So the reaction is that it is type 1 and 2. Then we look at the Lepromin activity. So what about the Lepromin activity? Is that it is negative or it is weakly positive? Weakly positive. Now, just focusing on the histopath. So histopath is that there is a tuberculoid. There's tuberculoid granulomas. So the tuberculoid granulomas, they are less prominent. And there is a something known as the Gren zone. So the Gren zone is more prominent. It is more prominent. And there is also transverse section. So there is the transverse section of nerve, and this shows a cut onion appearance. Cut onion appearance. So lastly, we look at the third question we asked. That is nothing but what is the lepromatous leprosy? So lepromatous leprosy, again, it is hyperpigmented macules, plaques, and nodular lesions, and there are innumerable. There are innumerable, and what we discussed earlier is that it is hypopigmented. There's macules, there's papules, as well as the nodular lesions. So now looking at the size. So if we look at the size, it is nothing but it is small in size. Then when we look at the surface here in lepromatous leprosy it is very, very shiny. So the surface is shiny. Next, when we look at the sensation. So what about the sensation? Sensation is nothing but it is normal. Then looking at the peripheral nerves. The peripheral nerves is nothing but it is there is symmetric involvement. The symmetric involvement, and this is of the nerve trunks. Symmetric involvement of the nerve trunks, and there is also the glove and stocking anesthesia. There's glove and stocking. This glove and stocking. This is anesthesia. Next, the nerves, it may feel normal. So if you look at the nerves, it feels normal, and it is normal on palpation or maybe thickened. It is normal on palpation or it is thickened. Next, we look at the hair. So when we look at the hair, it is nothing but it is almost normal. It is almost normal. And next, when we look at the bacteriology on the split skin smear, this is it shows plenty. There's plenty of AFB, and this includes the globi. So the globi are seen. So what about the type of reaction? It is type of reaction is 2, and the lepromin activity, it is negative activity. And looking at some of the important histopathology. So the histopathology, it includes, there's a Gren zone which is prominent. So the Gren zone. So the Gren zone is prominent. Other thing to note is that there is a expansive. There is expansive as well as the loose granuloma. So expansive or the loose granuloma. Next, there is also a plenty of macrophages. There's macrophages which are a plenty, and they are loaded with the AFB. There's Virchow cells. There's Virchow cells as well as the lepra cells. Then, if you look, there is the AFB. So AFB are seen in the endothelial cells. They are seen in the endothelial cells as well as the Schwann cells. Schwann cells as clumps. So this is nothing but the globi. So next, there is also the nerves are minimally involved. That needs to be known. Nerves are minimally involved.